Good morning, everyone. I'm Dr. Akanksha Bhat, from Assistant Professor from Patil College of Physiotherapy, Kolhapur. So today's topic is EMG setup and its parts. So this presentation was approved by Dr. Amrut Kaur Raizade Madam, Principal of Patil College of Physiotherapy, Kolhapur. So today we'll be covering what is EMG and what is the setup, how is the setup of EMG, and what are the electrodes used in EMG. So today's objectives are, at the end of this lecture, third year BPT students should be able to define or tell what is EMG, describes its parts, and to show how the setup is, and tell about various electrodes used in EMG. So EMG is a short form of electromyography. So the word is self-explanatory. What does electromyography means? It is electrical activity of a muscle. So EMG machine is basically a diagnostic or prognostic tool which is used to record electrical activity of a muscle when the nerve is stimulated, nerve which supplies that muscle is stimulated. So electromyography measures muscle response or electrical activity in response to a nerve stimulation of the muscle. So this test is used to help or to detect any muscle pathology. It can be of any origin, either neurogenic or musculoskeletal. So it is also used for prognostic tool also to see the progress of the condition as well as to diagnose any muscle pathology. So this test is help. The test is used to help detect neuromuscular abnormalities, and during test we need to record and stimulate the muscle and the nerve, for which we use electrodes. Mostly needle electrodes are being used. Needle electrodes are small needles which are inserted into the muscle through the skin. So to get EMG report done, we need to understand how is the setup of EMG. So first, going with the input phase. So EMG setup has input phase, processor phase, and output phase. In input phase, you have electrodes which will stimulate and record its response. So we have two electrodes. One is stimulating electrode, and the other one is used to record the response. So we have different types of electrodes which we will be seeing in detail. So basically there are two types of electrode, surface and needle. Needle electrodes give more appropriate reports. That is why mostly needle electrodes are used. It is inserted into the muscle through the skin. So after input phase, this is input phase, we have electrodes here. Once we get the response from input phase, it is taken up to amplifier. So your response is taken, amplified, processed, and showed into the output phase. So these four are output phase, and once your response is collected, it is amplified and processed, and it is shown as a visual biofeedback by in cathode ray oscilloscope, audio biofeedback in speaker. It is also recorded, and then a proper report is made in computer. So we have first output phase, that is cathode ray oscilloscope. It gives biofeedback for the technician and the patient. Then we have speaker, which will give sound of every response has a different sound. According to the sound also, we can identify what is the condition. Then we have tape recorder to record the response, and computer to better analyze the report. So moving on to the first output phase, or we say biofeedback, visual biofeedback, that is cathode ray oscilloscope. We also call it as CRO. So what is a cathode ray oscilloscope? So basically it is an instrument which gives you a graphical representation of your muscle activity. So this is the screen, fluorescent screen. Here we will get graphical representation of your muscle activity when the nerve and muscle is stimulated. So in this instrument, we have various kind of beam, electron beam, and which is deviated in a particular manner to generate that graphical representation. A cathode ray oscilloscope is an instrument that makes use of an electron beam and a cathode ray tube to display and analyze waveforms from electrical circuits. It is basically a very fast XY plotter that can display an input signal versus time or another signals. So a cathode ray is a beam of electrons which is emitted by a heated cathode or negative electrode and accelerated towards the fluorescent screen. So in this diagram, you will understand it better that we have a cathode ray which is heated, which will emit a ray which will get deviated in this deflection plates. So when it is heated, the cathode is heated, there is a beam which is passed in a forward direction. So the assembly of cathode intensity grid, focus grid, and accelerating anode is called as an electron gun. Its purpose is to generate an electron beam and control its intensity and focus between electron gun and fluorescent screen are two pair of metal plates. One pair is oriented to provide horizontal deflection and the other pair is oriented to give vertical deflection of the beam. So we have two beams. One is horizontal and vertical to give vertical and horizontal deflection. So these plates are thus referred as horizontal and vertical deflection plates. So these plates are called as deflection plates. So combination of these two deflections allow the beam to reach any portion of the fluorescent screen. Whenever the electron beam hits the screen, the phosphor is excited and the light is emitted from the point. This conversion of electron energy into light allows us to write with points or lines of light on an otherwise darkened screen. So here you can see that the beam is passed through an electron gun. We have deflecting plates which will deflect the beam in certain directions to produce a graphical representation on fluorescent screen. So this will give you a biofeedback, visual biofeedback. So auditory biofeedback, we have different kind of sounds which will come out when the responses are taken. For example, dull thud or raining like sound or else dive bomber sound. So these are few types of sound which are seen as auditory feedback. The speaker will give you auditory feedback. So to record and stimulate, we have few types of electrodes which are used in EMG. So there are two basic types of electrode. One is surface and needle. Surface electrodes are again divided into monopolar and bipolar or active. So you can see this is monopolar and active or bipolar. So these are not inserted, it is not invasive, they are placed superficial over the skin and it records the response. Most likely needle electrodes are show more adequate responses. That is why needle electrodes are used more commonly. So in needle electrode again we have monopolar needle, then concentric needle, bipolar needle, single fiber needle, and hook wire electrode needle. So these are the types of needle electrodes used in testing the EMG. So we'll recall in short. So we have seen what is electromyography. So what is electromyography? It is a electrical activity. It shows the electrical activity of muscle when the nerve is stimulated, which supplies the muscle. It is used to detect neuromuscular abnormalities or muscle pathology. So EMG setup includes stimulating and recording electrodes, cathode ray oscilloscope, tape recorder, speaker, and computer. So the setup first phase, we have electrodes which is used to take the response. Then we have cathode ray oscilloscope to give visual feedback, tape recorder to give auditory feedback, speaker and computer to record the report. So cathode ray oscilloscope is used as visual biofeedback, which gives graphical representation of electrical activity of muscle. And there are various type of needles to record these type of stimulus when various type of stimulus to record EMG responses. These are my references. Thank you.